while the NHS is celebrating its 70 years, the story of healthcare for all actually began 3 decades earlier in the Highlands. A report into poor living conditions saw the setting up of the Highlands and Islands Medical Service, a blueprint for what would go on to become the NHS we know today. Well, Nicola McAlley is at the region's largest hospital, Raigmore in Inverness. And Nicola, you've been watching state-of-the-art surgical procedures taking place.
Well, yes, the Highlands has come a long way since that report all those years ago, but the region has always been at the cutting edge when it comes to healthcare, and we've been fortunate enough to see some of the amazing work that has been going on here very recently. I'm now delighted to say that we're joined by Professor Angus Watson, consultant surgeon here at NHS Highland. Angus, thanks very much for joining us tonight. As I was saying, the Highlands has always been at the forefront of healthcare, hasn't it? Tell me about some of the examples of that.
So actually, since the Dewar report, we have done amazing things in the Highlands. So we had the first surgeons on the islands. Back in 1924, we had a surgeon in Lewis, and in the 30s, we had surgeons in Wick and Orkney. And in fact, we had the first air ambulance flight here, where we took 8 patients from the islands to a central hospital.
It's quite incredible when you think of it like that. And we were fortunate, you very graciously took us into one of your operating theatres very recently. Tell me about what you were doing and what that entailed.
So we were using keyhole surgery. Now, keyhole surgery really happened since I've been in training, and that's where we make little incisions in a patient's tummy wall and blow up the abdomen with some gas, and then use long, thin instruments with a camera to remove a section of bowel and do a join. And that allows the patients to recover quicker and get home to their own homes much quicker.
Amazing stuff. And tell me, what do you think the future holds for healthcare here in the Highlands?
I think we need to carry on being innovative, deliver healthcare solutions in a completely different way, just like our forebears did after the Dewar report.
Thank you very much indeed for joining us tonight, Professor Angus Watson here at Raigmore Hospital in Inverness. So the future for healthcare here in the Highlands, very much bringing it back into the heart of communities, but always with an eye on innovation.